what is required in it is actually 400 million. So that was what made us to do a lot of consultation. We didn't say we are not confirming them, but we want to do it in a very smooth way, whereby these challenges of budgetary constraints will not affect the staff once they are confirmed to P&B. Thank you, Chair.
Okay.
Rejoinder, maybe the CEO, we are in March. I think today is 1st of March. The 392 that you are talking about, the CEO, is for the entire financial year, that is 12 months. Now that we are even beyond half a year, in fact, we are remaining with the last quarter. The money that we gave you is around 222 million.
I hope you are writing all that, Chairman.
Thank you, Chairman. I'm actually tempted to go the direction of Honorable Jerry Bett, because one, we are talking about health. I don't want to even talk about the other departments. I can give you instances. For example, the hospital is supposed to offer service simply because the person who was there either was transferred or retired. Then, you know, as a board, you have the budget. I'm not even the budget. You're informed of the existing budget. I mean, why do we have to have such shortage of personnel who might have the occasion by the natural attrition, they've left service, and you cannot replace because of budgetary issues. And it is true, we are in the last quarter of the third quarter. We took out the last month. We've had a budget of 392 million from you as a recommendation. We availed 222. Yet you cannot actually still confirm, even during the tail end of the fourth quarter. I mean the third quarter.
So as you answer that, let me add also. He's quoted an incident. Let me also quote. We've gone round our facilities. We began with Kapkatet. Their mortuary is not functional. It may not be your mandate, but we just want to make you aware. Their ward, they've mixed the TB patients with those in the general ward. Now, we went to Lorette. We went to Social yesterday. Hear this incident. To tell you the kind of shortage that the county is facing. We are staring at a very serious crisis. We met a health worker, a nurse, who was on duty. She told us that there was a day she had 3 mothers who were about to deliver. One had high blood pressure, 190. The other one was 7 months, and she was about to give birth. The other one was giving birth for the first time. There's a name the medics use. I don't want to use that name. So these are 3 cases being served by one nurse. One nurse. And all these three cases needs referrals. Who will she accompany as she takes them to the hospital? This is a very serious case that captured our attention. And this was the 3rd facility. So you can imagine what goes on in the other facilities. The district hospital, if you go to the ward, you find one nurse manning a whole 65 ward. You find one nurse manning a whole labor ward. And yet, as an assembly, we have done our part. We have appropriated money for confirmation and even replacement. But as a board, you have not done your part because of bureaucracy. If we say that you, as a board, have failed this county, will we be wrong? Thank you.
Your Honorable Chair, in furtherance of the same, as you answer that one, and also I'd ask you about your independence as a board. Is there any quarter that manages your decisions from somewhere.
And so that you answer all of them, Chairman, what does the law says about keeping people on contract for the longest period of time? Don't you think you are going against the laws by keeping people on contract all those times? And you heard what the Honorable Chair said. We've been visiting some of these facilities, and I know you might not be the victim. You have an insurance, you have a cover that is paid by the government. But your relatives, I know the chairman, you come from those places, Sigawe Soin. We were in Sigawe Soin yesterday. You might not go to that facility because you have the cover, but your relatives would be treated there. I know there is one person here coming from Bureti. We went to Kapkatet. The problem that is in Kapkatet, I think God forbid, because there is serious challenge here. I know you might not go to district hospital, but some of us will go because our relatives goes there. You might not go there, but your relatives will go to the county referral hospital. When you go to Kapkatet, for example, where I think one of the members of the board come from, those patients that are suffering from what do we call tuberculosis are in the same ward with other patients. In fact, as we speak, 2 nurses are also under isolation. So you can imagine a patient from different disease, they are combined in one ward with those suffering from tuberculosis. As I said, you might not go there as a member of the board and your children because you have the insurance cover, but your relative will go there. Your sister's sister will go there. So ultimately, we need to solve all these issues of healthcare in our county together because we come from this county. So when you see us talking passionately about these people, it's because of the challenge.
There is nursing officer, job group K, four positions. Kenya registered community health nurse, 38. There is medical laboratory technologist, 18. Assistant public health officers, 6. Registered clinical officers, 9. Assistant health records and information officers, 6. Pharmaceutical technologist, 5. Radiographer, imaging, 4. Nutrition and dietetic technologist, 3. 5 positions. Physiotherapist, 2 positions. Occupational therapist, 2 positions. Orthopedic trauma technologist, 3. 4 positions. Registered clinical officer anesthetist, 1. Registered clinical officer ophthalmologist, 1 position. Okay, those were the positions in all. So these were replacements which we were supposed to replace.
Okay, as you respond to all those other questions, what is the cost of advertising? And even sitting in those meetings, can you give us a cost for the whole process, up to even until the day it was stopped?
Yeah, it's expensive. It doesn't mean that if we halt briefly, unless it is over a period of 6 months. If it is within a period of 6 months, if the process is halted, it can be continued. If it is not,
But give us the cost.
The German is asking for the cost. Going to Kisumu for shortlisting, going to Nakuru, and then someone somewhere sits down and just said later to stop.
Yeah, it is. It can cost a lot. I can't.
Can you give us an average?
An average.
For advertising, I think we approximately, let's say 1 million, because remember we did an advert in the Standard and also the Nation, and also we don't always go out for the exercises of shortlisting the exercise, but for the ones that we did, I think it goes around maybe roughly 3 million.
So the whole
exercise
is put it at
cost about,
maybe 5 million.
so the whole exercise is about 5
So-
million.
But that is